Hello, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today we are interviewing Dr. Rosalind Canizares. Welcome.
Thank you for having me.
It's great to have you.
Thanks for being here. Rosie is joining us on the phone from Duke, so she's far away. So Rosie is a board-certified clinical specialist in sports physical therapy. She's a double Duke alumnus who has been active in the Duke Alumni Association, including being selected as one of the first young alumni representatives to the Duke Alumni Association Board of Directors, and starting the Duke Dancer Wellness Clinic, which provides dance medicine outreach services to the Duke Dance Department. She has also worked in Durham at the American Dance Festival. An active member and leader of the Performing Arts Special Interest Group of the American Physical Therapy Association, she has worked with several professional Broadway and dance companies, and she just told us that she is now the vice president of PASIG, or the Performing Arts Special Interest Group, so very cool.
That's very amazing.
Yeah.
Rosie is here today to discuss overuse injuries, so let's dive right in. Why is it important to talk about overuse injuries in dancers?
So it's important to talk about overuse injuries in dancers because they're preventable. Another way to describe an overuse injury is a repetitive strain injury. And it's important to note that 95% of dance injuries can be treated conservatively because they are overuse injuries. And the most important category of factors associated with dance injuries is training. So a lot of the injuries that I see in dancers are just because they're not using good technique. And really when I treat a dancer, I evaluate them as I would any patient who I would see in physical therapy. And then I want to make sure that they are using their muscles correctly and that they can activate their muscles properly. And I use layman's terms when I'm evaluating my dancers so that they feel more comfortable around me, and really the turnout muscles are really important. There's a lot of basic dance movements that people will try to teach to do when they're dancing. So for example, forcing your turnout. And so my job as a physical therapist is to make sure they're keeping within their anatomy and not just trying to strive for that perfect, actually unachievable 180 degrees of turnout. So I really want to make sure that my dancers are using the correct muscles so that they're dancing healthy and that they can avoid these overuse injuries.
Awesome. So you kind of talked for a second. You said overuse injuries are a repetitive strain. Can you go a little bit more in depth and talk to us about what an overuse injury is?
As I said, another good term for the repetitive strain injury. So in opposition to an overuse injury, the other category would be an acute injury, something that happens one time. You can point to it and say, this is exactly when I hurt my knee. I heard something pop, I heard something snap, and then I couldn't dance the same afterwards. Whereas with overuse injuries, dancers tend to be type A personalities. Mm-hmm. They're very perfectionistic. They'll keep going, and they'll keep going until they get it correctly, when that's not necessarily healthy for a body. So that can also lead to overuse injuries.
Okay, so are there any specific causes of an overuse injury that you found in your career?
So again, I think I've already mentioned dancers tend to be very type A and perfectionistic. I think a lot of the different dance styles, people tend to want to create a pretty picture in their head or just model dancers that they've seen, but not everybody's bodies are created the same way. So you want to make sure that you're dancing in a way that's healthy for your body and really using your muscles and not just trying to force your body into positions that it's not going to go into, particularly when you're doing things over and over again. So for example, the way that you plie and the way that you releve is how you take off and land for a jump. But if I can look at a dancer and see that she's cycling in releve, that she's rolling her feet in plie, then that's what's going to happen over and over again during a dance class. And in a typical ballet class, research has shown that there's approximately 200 jumps in a typical ballet class. So if they're exhibiting those poor movement qualities over and over again, then one of their joints is going to hurt.
Yeah, that makes a lot of sense. Mm-hmm. So it sounds like you're talking about poor technique being a big causing.
Yep, you got it.
Yeah.
The nice thing about working with overuse injuries too is that when dancers come to see me and I can speak in their language, If they do something incorrectly, they have pain, but if I can get them to use the correct muscles and work within their own anatomical limits, and they can do the same movement without pain, then I think that's pretty informative for the dancers.
Absolutely. So, okay, you talked about an acute injury where you kind of, you know exactly why you got your injury, and you can say, oh, these are the signs and symptoms from this injury. Let's talk about an overuse injury. What are some of the signs and symptoms of an overuse injury?
So definitely pain's a big one. I think dancers are just as big culprits as anyone else of dancing through pain. I think a lot of dancers think that pain is a normal thing, or they believe in that old adage of no pain, no gain, which I as a healthcare professional don't believe in. So I would encourage my dancers to listen to their bodies. I mean, obviously dance medicine is pretty similar to sports medicine in that there's sometimes reasons why you can't just stop and rest. But I think the good thing with dancers in particular, if they're coming up with performances, hopefully there's ways that we can modify the choreography so that they can do things that are less painful for them. But pain is obviously a big one, and then the other symptoms that you think of with injury, swelling, weakness, if something feels off, if something feels like it's going to give, but definitely listening to your body and not pushing through any type of pain.
Okay, so let's pretend that a dancer has experienced this and now has an overuse injury. They're diagnosed with it. How long does it typically take to recover?
So it takes tissues 6 to 8 weeks to heal, but what I try to tell all of my patients, and not just dancers, is that the quicker you can shut it down and do things pain-free, the quicker you're going to get back to 100% dancing pain-free. So, pain is just one kind of inflammation. The longer you push through that pain, the longer you're just going to be adding inflammation on top of inflammation. So it does take that 6 to 8 weeks for tissues to heal, but I think the longer you're dancing through pain, the longer it's going to be before you can get back to 100% without any pain at all.
To clarify, are you suggesting that a person with an overuse injury take time off?
If they can. I mean, again, I think it depends on where a dancer is in, their career, in their performance season. But I think that there are ways that you can modify things that you're doing in class or in performance so that you're not having to do the painful activity. I tell my patients all the time that you can do anything that you want to do that's not aggravating your pain. But the longer that you do things that are aggravating your pain, the longer it's going to take to be able to do things pain-free. So it's not an all or none thing with dancing. I think that's why a lot of dancers are hesitant to go seek health care because they don't want to just be told that they should stop dancing or that they need to take X amount of time to rest. I do think that rest is important, but I think that, depending on what your injury is, you can still be doing things without pushing through that pain.
That makes sense.
So, a lot of times in my evaluation, too, in a typical physical therapy evaluation, we'll ask you what activities aggravate your pain. So when working with dancers, I try to ask about specific dance movements, and most dance injuries are lower extremity or leg injuries. And so you'll find, the bigger dance movements that require more force through your joints, like jumping and turning, arabesque. Those are the things that really aggravate their pain, but they can do like bar work or, center stuff that doesn't involve jumping and turning. And if that's the case, then they can still do those things and then progress slowly back to the activities that are aggravating their pain.
Mm-hmm. So another question, do you help your dancers if they have questions about how to modify things?
Absolutely. Yeah. I mean, particularly if it comes to performance, I think that especially if you're a soloist, there are ways that you can modify your choreography, or if you're just in the beginning phases of rehearsal and going into it knowing that you had some nagging injury, that's a great time to go into it choreographically because, just be smart about it and don't do yourselves on the leg that hurts, right?
Yeah.
See if you can turn on the other side, see if you can land your jumps on the other side. And then there's easy things too, like doing PKs instead of umbrella legs for your pirouettes, things like that.
Nice.
But yeah, if a dancer is pretty close to her performance, and particularly if it's a solo, run their choreography with them and give them feedback to see if there are little ways that we can change the choreography. It'll help them get through it pain-free.
That's a great resource.
Decreased pain.
Yeah, awesome. Okay, so let's talk again about recovery. So what can a dancer expect during the recovery process? So, like, for example, will a dancer need to go to a physical therapist or perhaps another healthcare professional, or we already talked about modifying their dance regimen perhaps?
So I think it will depend on what kind of access they have. Again, ideally, they would be able to see any healthcare team member who has some background with dance. So I think it's even more important not just which professional they see, but to make sure that they have experience working with dancers. Because I do know that a lot of healthcare professionals who don't understand dance will just say, oh, we'll just don't do anything for, 2 weeks, 4 weeks, whatever. So I do think it depends on what type of access a dancer has, and it varies depending on what setting you're in. If you're in a big city, if you have access to healthcare professionals who have experience working with dancers.
Yeah.
Right, access. That's a whole other topic.
Oh, absolutely.
Yeah.
So,
hopefully, whoever their teachers are, or whoever's training them, hopefully they are able to keep the health of the dancer in mind, and hopefully they would have some good suggestions about who to see as far as healthcare professionals go.
right. How can you decrease your risk of sustaining an overuse injury?
So again, listening to your body, trying not to push through pain, not thinking something will just go away. I think especially if you've never been to a healthcare professional, if you have that access, I don't think it's ever too soon to see a physical therapist just because we are the movement experts, and we can find decrease in strength or muscle compensation patterns even if you're not actively having pain. So I know you've had another episode on screening, but I think physical therapists can screen. And so I think, an even more important part of my job is to prevent future injury than it is from rehabbing injury. So if you've had an injury already and you kind of know the rehab exercises, then it may not be as important to go in right away. But I think if you've never had an injury and it's something that's just been nagging, I think the sooner you can get in, the better. I also think that resting and recovering is important, not necessarily stopping from dancing completely, but making sure that you're getting enough sleep. I think pain's a multifactorial thing. Mm-hmm. I tell my patients this all the time. Stress can certainly play a role in it, sleep, and that can become a feed-forward cycle if you're stressed, and then you're having difficulty sleeping, and then that's making you not think about your technique when you're dancing. As part of the Dancer Wellness Clinic, I work with a physician, so we do hour-long appointments. We go over comprehensive past medical history, female athlete, nutrition, stress, and sleep. So I think those are all aspects of dancer wellness. And the same way that you rehab from an injury is the same way that you prevent injury too. And I would say that another way of decreasing your risk of sustaining an overuse injury would be to go back and retrain your body, because it's essentially what we're doing in physical therapy. Make sure that you're really doing things with the correct technique. I know it's hard with dancers because a lot of times, especially with choreography, you're thinking about a theme, or you're really trying to go for that aesthetic aspect. But when you're rehabbing from an injury, it is important to go back to think about what muscles you're actually working. Mm-hmm. And so when I see my patients, like I said, I identify their weaknesses, but then I want to make sure that they're able to strengthen those in isolation and correctly, so that they're now using correct technique. And I want to make sure that they can use those muscles when they're playing, when they're doing different dance activities.
I think for those of you who are listening, you should tune into our episode before this about cross-training, because I think what you're saying, Rosie, has a lot to do with the cross-training as well.
Oh, yeah, big connection. Mm-hmm.
Yeah, and I think, my bias has been ballet. That's where I did the most training. Mm-hmm. But, I think a lot of ballet dancers will live their life in a turned-out position, and so that's not necessarily healthy for you either. So keeping that in mind, I think for any dancer, any person walking off the street, posture is a big thing too. Mm-hmm. I think that's why I love my job as a physical therapist, is that there are little things that you do on a day-to-day basis that you don't realize, but that could be contributing to the pain that you're having. So for any back pain or hip pain even, just watching how you sit. A tip that I give to dancers a lot of times is make sure you're sitting how you're dancing, because dancers will have great posture when they're dancing, as long as that's what the choreography calls for. And then as soon as they're done, they'll slump right back down into a slouched posture.
Yeah, we've seen that.
True. Mm-hmm. Mm-hmm. We're down to our last and my favorite question. So, Rosie, please tell us your favorite story about treating a dancer.
Yes, that's actually the toughest question, I think. I just love working with dancers. I think what comes to mind is one of the first professional dancers that I got to work on. I actually got pulled out of a master class that I was taking at Duke because one of the company members had an injury, and that was just right up my alley because I was in way over my head taking that master class. But that was 7 years ago now, and he's been in different companies. He's since transitioned to Broadway, and it's just been fun. I mean, I think being a dance medicine physical therapist and not being in New York, like, I don't get to see dancers all the time. And I think, it's pretty rare for a dance medicine physical therapist, unless you live somewhere like New York, LA, Vegas, to be able to see dancers all the time.
Right.
But I get my fill here in Durham. We're a pretty thriving arts community now, but it's great because this dancer who I met 7 years ago, I've now seen perform 4 different times.
Wow, how
just
rewarding.
in Durham. So it's been great to be able to see him in different styles and to keep in touch with him and to know that, he had this injury that was bothering him 7 years ago, but he's still been able to have, a nice dance career.
Absolutely.
Fabulous.
7 years is a long time.
Yeah.
Well, thank you so much for joining us, Rosie. Thanks for sharing all your knowledge.
Sure.
Yeah.
Thank you.
Of course. And as always, thank you to our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you so much. Bye.
Bye.